Carotid and Vertebral Stenting. As an individual ages, the arteries of the neck and head can fill with plaque deposits caused by atherosclerosis, leading to a narrowed vascular segment known as a stenosis. Heredity, hypertension, high cholesterol, smoking, and diabetes can all contribute to their formation. No small thing, seeing how these blockages can result in blood clots and stroke. But before an individual suffers a stroke, he or she may experience what is known as a transient ischemic attack, or TIA, which is sometimes called a mini-stroke. TIA symptoms mimic the neurological deficits experienced during an actual stroke, except that during a TIA, symptoms are usually present for less than an hour. The occurrence of a TIA prompts the immediate evaluation of the affected individual with either an ultrasound neck exam, called a carotid duplex study, or CT or MR angiography. Once a severely narrowed neck artery, most commonly the carotid artery, is identified, it can be addressed by traditional open surgery, known as carotid endarterectomy, or through less invasive endovascular stent placement. A stent is a thin metal mesh tube designed to hold open a vascular segment narrowed by atherosclerosis, and thus facilitate normal blood flow. The stent insertion is accomplished by an IR physician through a small groin puncture under local anesthesia. After the plaque causing the narrowing is balloon dilated, a process known as angioplasty, a stent is deployed at the site of the dilated stenosis. Carotid balloon angioplasty and stenting are performed with a small retrievable endovascular filter that protects the cerebral circulation from any debris that may result from these procedures. The recurrence of vascular narrowing following stenting is comparable to that of open surgery, but the recovery time is far shorter, and the impact of general anesthesia and neck nerve damage are absent with the endovascular approach. Successful stenting is followed by rapid discharge to home and treatment with the blood thinners Plavix and aspirin. A neck ultrasound exam is performed 6 and 12 months later to assess for any vessel renarrowing. At present, Medicare will cover the costs of carotid stenting in patients where the carotid narrowing is 70% or greater and is symptomatic, and if a patient is at high risk for carotid endarterectomy.